Transitional Care Management CPT codes. At first glance, they can be confusing and intimidating, as well as the program itself, but once we break it down, they are relatively easy to understand. In this video, we'll give you everything you need to know regarding the Transitional Care Management, or TCM CPT codes, and what you'll need to properly bill and code, as well as maximize your reimbursement opportunities. Hi, this is Lauren with ThoroughCare. Here at ThoroughCare, we help practices just like yours every day manage, bill, and streamline popular care management programs like Transitional Care Management. Knowing the billing codes for TCM will give you a better idea of what's expected by your staff and by Medicare to properly bill for these programs. There are two CPT codes for Transitional Care Management, and those are based on the complexity of medical decision-making. But before we go over the codes, let's take a look at how Transitional Care Management actually works. Transitional Care Management manages the patient's first 30 days after some sort of discharge. The goal is that the patient avoids readmission and makes for a smooth transition back to their everyday life. The patient's discharge must be from one of the following settings: inpatient acute care, inpatient psychiatric care, long-term care hospitals, nursing homes, inpatient rehabilitation centers, or hospital outpatient observation or a partial hospitalization. So who can offer TCM services? TCM services can be done by primary care doctors, specialists, or non-qualifying medical practitioners. TCM consists of three segments: interactive contact, non-face-to-face interactions, and finally, an in-person office visit. Now, let's talk a little more about the interactive contact. The interactive contact for TCM must be done within 2 business days, so that pivotal 48 hours after discharge. This can be done by a clinical staff member and also can be performed via telephone, telehealth, or an in-person visit. For the non-face-to-face services, this can also be done by a clinical staff member or the provider team. These services may vary based on who is providing this type of care. The non-face-to-face services usually consists of documenting in some sort or fashion. This document can be reviewing medications, can be reviewing the hospital discharge, or any other important information that needs to be reviewed by the patient's care team. And finally, the last portion of the transition is the office visit. Now, the office visit must be performed by the physician who is responsible for the patient's transitional care management. Now, this portion of the TCM must be done within a certain period of days based on the complexity of decision-making. We'll talk a little bit more about that later. One other important note: that office visit done as part of the transition, that is part of TCM and should not be billed as a separate E&M visit. So that's something to consider when providing the TCM service. Once all 3 segments of the TCM have been completed and the patient was not readmitted within a 30-day period, billing can commence. Now, there are 2 CPT codes that you can bill for Transitional Care Management, including 99495 for moderate complexity of decision-making, and 99496 for high complexity of decision-making. Now, you may be wondering, what goes into determining that complexity? Well, here are some things to consider. How many possible diagnoses or the amount of care management options need to be considered, the breadth or complexity of medical records, tests, or other information that needs to be analyzed, or the risk of significant complications with the patient's presenting problems, diagnostic procedures, or the possible management options. Both CPT code options account for medical decision-making, but it's ultimately up to the provider to determine the level of the decision-making. At the provider's discretion, one of the following can be used for Transitional Care Management. For moderate complexity of decision-making, billing code 99495. So no matter the complexity, you'll still need to outreach your patient within those crucial 48 hours, but you have up to 14 days after the discharge to see your patient in office. the national average reimbursement of a 99495 claim is about $176. The other option is to bill for high complexity of decision making using CPT code 99496. You'll still need to contact your patient within 48 hours for that non-face-to-face interaction. But with high complexity, your face-to-face visit has to be within 7 days of the patient's discharge. This code pays at about $236 nationally. One thing we didn't mention yet is the low complexity of decision making. Now, for TCM, you cannot bill for low. However, here at ThoroughCare, we strongly recommend that you still complete transitions for these low complexity of decision-making patients, but you can't bill. Having a completed TCM will still ensure that the patient has a smooth transition home and also add to your value-based offerings at your practice. So now that you have a better understanding of transitional care management and its CPT codes, what should you do next? There's a link in the description below to our Learning Center. Our Learning Center is the best place to find out rules and regulations of TCM, as well as the other value-based care management services we provide. You can also find tips and tricks on how to run a successful program. Ready to talk more about how ThoroughCare can take your organization to the next level by providing TCM services? Contact me or an account representative for more information to set up a discovery call or even a live demonstration. You can see a link right here below. Don't forget to subscribe and like this video, and thanks for watching.